Okay, I'm speaking with Erica Hansen, infection prevention specialist at Cheyenne Regional Medical Center. And is it Dr. Hansen?
It is not, no.
Okay, Erica, we have a drug if I could talk this morning, drug-resistant infection that's been found with a patient at Cheyenne Regional Medical Center. Is this something the general public needs to be worried about?
Well, antibiotic resistance in general has been a nationwide concern, increasing over the last decade or so, just because we want to make sure we have the appropriate antibiotics to use for people that have infections. It is not a specific concern. This particular case should not increase people's anxiety or concern in Laramie County.
So this is not like a bad science fiction movie where we get an epidemic and nobody can stop it and it's really dangerous.
Correct.
Now, what causes these type of infections to develop? I mean, why are they antibiotic resistant?
There are lots of different ways bacteria can be resistant to the antibiotics we normally use. They produce enzymes that make them resistant. In this case, it's a gene that the bacteria has. So the important thing is making sure that we don't share these kind of bacteria between people and generally patients, because patients are more susceptible, being that their immune status is already being taxed.
And this is another reason why if you're given a prescription by a doctor for antibiotics, you should go ahead and finish it even if you feel okay. Is that right?
Generally, yes. We want to make sure that we take antibiotics as prescribed, so that's the full course, and that doctors are really becoming very educated and aware of not over-prescribing antibiotics for something like a virus. An antibiotic wouldn't work. So being careful when they're prescribed and taking them as directed.
Now, from the news release from the Department of Health, I understand you folks and the Department of Health are going over your infection prevention procedures just to be safe. Is that right?
That's correct. So when we have a drug-resistant bacteria, we do take some extra steps just to make sure that it's not transmitted among patients or healthcare workers, and all of that has been in line for this case. So we have no reason to believe that there's been any transmission, but we always stress appropriate precautions for, caring for a patient when you're dealing with up close next to a patient, and obviously hand hygiene is key.
And my assumption would be you're not identifying the victim, correct?
Correct.
Okay, now let's see. Is there anything else I wanted to ask? Is there anything else I should ask that people need to know that I haven't asked?
No, I think just know that bacteria is everywhere in our environment and, in your body, and most of the time it's either doing good or causing no harm. So just good hand hygiene and, keep being healthy.
And I understand, although we can't identify the victim, they are doing relatively well, correct?
Correct.
Okay. Erica, I appreciate the call back.
Yeah, no problem. Thank you.
Bye.